I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. How's everybody doing?
Fantastic. How about you?
Good. Chuck zooming in. Commissioner Hinkle is. I guess the first thing we'll go through and let everybody, I'll have to speak up a little bit. I guess this is your deal, right?
Are these not even on?
Yeah, I turned them down because they were buzzing really loud.
We just go down per, like Chad will be first, and then we just go down, and then we give our report, and at the end.
Okay, well, I'll just call it the agenda, but I'll introduce it. Everybody will have to introduce themselves, so everybody knows who's here. We'll start with you.
I'm Jen Robinson. I'm the PEP coordinator for Granite County.
I'm Chad Lannis, the Tri-County Sanitarian.
Michael Archick, Granite County Board of Health member.
Amanda Borer, Tri-County Tobacco Prevention.
Leanne Holmes, Public Health Director.
Robin Reynolds, Mental Health Coordinator.
Taylor Sanders, Healthy Granite County Network.
Okay. So everybody's introduced here, and then we have other people on. Blaine zooming in, the county attorney, and then the doctor's down. So I'll go ahead and we'll go right into the county sanitarian report from Chad.
So as far as the report, it's just kind of a general, we wrapped up the end of the year. I'll have some actual hard numbers as far as septic permits issued and development. Last year, we issued more permits last year than we have in the 27 years since I've been here. So since 95, it was another, the prior year was a crazy bit development year, and 2021 didn't slow up or stop. We'll see what this next year brings. We did wrap up the majority of our health inspections. Mark had prioritized those in the risk factors. So like a bar that just serves alcohol would be the lowest risk factor. Restaurant that does a lot of prep and cooling is the highest risk factor. So I think he got probably between 80 and 90% of those done. And we were able to physically go back into every one of those establishments again. So that was great. We did a food service training just a couple weeks ago in Anaconda. So we're going to start getting our food service training back online. It had been a couple years since we'd done that with COVID. And so we sort of approached it from a different method, and I think that it was successful. We had 15 people and they seemed to like it. So we'll see how the test results go. That's how it went. But the training seemed to go well, and the people seemed to get through it pretty good. So the only other thing that I have is every year we do what's called the cooperative agreement with DPHHS. Basically, it's just says that the county will assign somebody to do those health inspections, and we'll get reimbursed to do them. And we do this every single year. So nothing's changed. We get a certain percentage of the license fees back. That's like 80%. It's a pretty good chunk of them for every one that we do. So we get quarterly payments on those. So the budget should reflect those too. But basically, we just need the chair to sign that, and I can get that sent back in.
Okay, we'll probably have to have a motion on it just to make sure. It's
I'll make a motion.
Yeah.
What am I saying?
Motion to approve the cooperative agreement with DPHHS.
Yeah.
Do I have a second?
I second.
Any public comment? Being none, all in favor?
Aye.
Aye. This motion is carried back.
Thank you. I'll leave you guys a copy of that, and I'll get that sent back up today. So
There is a comment after the fact from TVFN.
Oh. TVFM, go ahead. Who's that? Go
This
ahead.
is this is Elena Gagliano, TVFM. It's kind of confusing trying to follow this. Chad, are you talking about that 10-page agreement that's on the documents?
Yes, ma'am, that is what that is.
That's the
We'll
10
research.
page. Okay, thank you. That's what I just wanted to confirm. Thank you.
Yeah, sorry about that.
Thank you. Okay. So that's, anything else?
I think that's kind of it right now. Development's slow, even though I had people doing septic systems at Christmas time still, so. And I had somebody who wanted to dig a test hole in Rock Creek tomorrow, but I talked him out of it, so.
Okay.
Yeah.
Chisel, chisel,
Yeah,
chisel.
yeah. How bad do you want it? So, yeah, anyway, the development stuff is tapered off, and now we're turning the page on the food inspections, and Mark's outlining how he's gonna get those done, so. Kind
Okay.
of back to normal.
That sounds good. Thanks for the report.
Yes, sir.
Good job. The only thing I have is just a little more communication. I know I gotta be better about it too. I'll get with you on a few other things that
You
I've had
betcha.
people call, but I forgot.
Sure.
It's not me.
Well, yeah, no worries. Yeah, yeah, and I am, of course, things get screwed up sometimes, but I am generally here Monday, at least the first half of the day in the office, if I'm not out in the field. So I'm trying to get a little more presence here within the courthouse. So.
Okay. So we'll jump right into the Granite County FEP report from Jennifer.
Morning, everybody. I'm Jen Robinson. I just want to give you a short little update. It's a smaller update than last time. In this county, we have 27 cases of COVID. There is Omicron in this county. It was, there was a report last Wednesday that there is Omicron in this county now. There is 2 people in the hospital that are actually in ICU that have COVID, okay? My FEP report was submitted last week and everything looks awesome. The state they're really happy with it. And I did do some truck training, Rex with Chad and Mark a few weeks ago. I think we did a training on truck Rex. So they're all up to date and ready to go with the state on that. And then the only other thing I have is I did present all the new paperwork to you guys. I put them on Scott's desk over there. 3 of them have been signed by you guys for commissioners, and the other 3, we just need to have Mike sign right along with you at the Board of Health. Blaine did look at them. He approved them all per wording for this county. I just need signatures just to update for the yearly.
Just whose signature?
I need the commissioners and Mike and Chad, and then I will get Kara, and then when I go back to Anaconda, I'll get her signature because I know she's in the office today. So I'll run by her office in the next day or so and get that signature. But Blaine did sign all these off and approved them. So, and that's my report.
Okay, is there any public comment? Here you go, Mike. Any public comment on Jennifer Robinson's report?
Elena.
TV, FM.
You can refer to me as Elena. All right, now, are we talking about the COPP or the COOP that needs signatures? The 5 pages?
Yes, ma'am.
Okay, on page 3, well, first of all, I think it'd be better to call it Granite County because there is a ghost town called Granite. Don't want to be picky, but that's what it is. And then on page 3, under decision process, Granite County does not have 9,000 residents.
Oh, that was a typo on my part. I will fix that. Yes, ma'am. Thank you for bringing that up.
Is this the same one that Jefferson County has?
No, there's the document is for each county, and it's not the same.
Right, is it using a template or something for Jefferson County? Because I don't understand why Jefferson County comes up.
It does say Jefferson County on the thing when you look at it online.
Oh, does
Yeah.
it? No, because I've been using the same one that Granite's been using for all these years. I just updated a few informations into it. I'll look at that for the Jefferson County. Thank you.
Okay, one other thing, is Michael Kalichik still the chair of the,
Yes.
Yes, he
all right,
is.
then shouldn't you be doing the, conducting the meeting and not Scott Adler?
Good.
Parliamentary procedure, I defer to the chairman. You know,
He deferred it to me, so we're just doing it this way. It's fine.
Oh, I see, because that wasn't announced in the beginning.
Didn't
Okay.
come back.
Thank you.
Thanks
Thank
for
you,
your
Elena. And
comment.
I'll look at everything you just mentioned. Thank you, Elena.
You're welcome.
Thanks for your comments.
Blaine has comment.
Go ahead, Blaine.
Regarding the 3 documents for the Board of Health, I would encourage you to have them do a motion on all 3 of those.
I
Okay,
make a motion that,
we just got them, so we're getting ready to. We just haven't.
Oh, okay, okay. Sounds good.
Blaine,
So, go ahead, Blaine.
okay, so is it the transport plan and public health procedures?
There's 6 of them, and you already signed 3 a week or so ago.
Okay.
And the other 3 had to be brought in front of the board because it's the rabies, the transport, and the bioterrorism one. I believe is the 3 I had to bring in front of the Board of Health. That was because Blaine and I were talking, because it's a lot of medical terminology. And I did send this to the board about 2 weeks ago. I believe I sent it to you guys' email to be reviewed, and nobody commented back. So I believe it was good to go for today.
Okay.
What she said. Did you get that?
She's got it. Do I have a second?
I second.
Yeah, I'll second it.
Any public comment? Being none, well, all in favor?
Aye.
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 Thank you, guys.
Thank you. Good job. Okay, so now we're on to, whoops, was you done?
I was done.
I'm
Yes,
sorry,
sir.
I'm sorry. I'm just trying to keep it.
No,
going.
I'm done.
Sorry about that. Okay, so we're on the mental health coordinator report from Robin. I'll just say Robin. You'll come up and state your name so that she can hear you, or not. Yeah.
I'm Robin Reynolds, and I'm the mental health coordinator for Granite County and Deerlodge County. And I went to training the end of November, beginning of December for CIT training in Helena. And I was hoping to get some officers from over here to attend. I think it was short notice. So they're gonna have one hopefully in March. So I will get with Scott Dunkerson over here to see if he would like to send any officers, first responders,
And what's this training on?
crisis intervention team training. It was a 40-hour training.
And what's it do? I'm hard here.
Oh, it's okay. It's crisis training, different tools to use for getting into emergency situations with mental health crisis. So as soon as I know the dates for March, I will talk to Scott Dunkerson and see if he could send any officers or first responders or dispatchers. It was a really good training.
And you're taking care of that, you'll make sure and get a hold of them?
Mhm.
Okay.
Yeah, as soon as I know, there isn't any updated dates for 2022. There were only 2021 dates on there for training. So as soon as I know.
Is this voluntary attendance?
So
But our
do they
grant
have
will
to do
pay-
40 hours?
It is a 40-hour week. I think they do 8 hours for law enforcement academy,
Okay.
but yeah.
Because I was gonna say, that's gonna be kind of tough to
It
pull a
is.
deputy away for 40
There is
hours.
money available to pay for it through this grant, so.
Yeah, you'd have to talk to him and he,
Yeah.
because he's got his schedule and I
Right.
can't speak with him, or we can't, I'm sorry.
No, you're fine.
But
No,
that
as soon
way
as I
you
know, I
make
will
sure-
get them
Make sure and get a hold of him, give him a heads up before the last minute.
right, absolutely. And that's my update.
Okay, well, thank you.
Can Dr. Khan jump in now? She's gonna have to see patients.
Yep, go ahead. All right, well, thank you, Robin.
Thank you.
Hi, so
Go
I
ahead.
apologize as I had to jump in. but I just wanted to make sure that there was an opportunity before I have to scoot away to go see a couple of patients. There were a couple of things that Billy had emailed as far as questions about threshold testing and COVID testing and some masking questions. And I wasn't sure exactly what the question was.
I'm not quite sure what the question was either.
I believe them questions came from Elena, that she wanted clarification on like the threshold on the testing for COVID and all that. I believe all them questions came from Elena.
Did you copy that?
Here, I can unmute Elena, and she can clarify it in her talk.
It's from Elena.
Okay, this is Elena, Dr. Khan. It was a while ago that I asked for it. And there's apparently a threshold with the COVID tests. And now I don't remember how it went, but I guess anything over 30 being the threshold is not advisable, and all the tests should be at a 30 or below threshold. Otherwise, the higher it is, it can pick up anything. You have a cold and it'll come through as positive. It gives a false positive. And the Department of Health and Human Resources I was dealing with, and now I don't remember his name, but he said that they don't have to tell you what the threshold is. But I did find a threshold from a Canadian public health board. So I do have that information, and it confirms that the threshold should be 30 or below, but apparently Montana doesn't want to say what their threshold account is.
Well, there's two parts to that. I think what you're actually talking about is a cycle, where they're talking about how many cycles does a specific PCR test have to run before the test becomes positive. And depending on the PCR test that you're using, that cycle is different. So it's going to be different from hospital to hospital, and it's not a consistent cycle rate from one to another. When you're talking about a threshold, it's how many viral particles have to be present in order to tell that test that it's positive. So those are two different numbers. But I think what you're talking about is the cycle. And you're correct that the higher number of cycles that you have means that there is a smaller number of viral particles, and begs the question of, are you picking up a true positive? Is it the very tail end of something and there's only a couple of viral particles? And unfortunately, we really don't have, different than some other testing where we have a titer or we have a rate of what does that number tell you as far as infectivity. We don't have that for COVID. And so across the board, what we're testing is positive or negative. If you ask, the hospital will tell you what your test was and what the threshold was and what your cycle rate was for any particular test. But it would require that patient visiting with their provider to decide how likely that was to represent a true positive versus a false positive. And that's different than the rapid testing. The rapid testing doesn't have that at all.
So for instance, Granite County Medical Center. So in there, when you sit in the parking lot and they give you the test, is that a PCR test, and is that a rapid test? Because it seems they get the results real quick.
I don't actually know if they're using an in-house PCR now or not. Before, it was a rapid antigen test, so it wouldn't have that same rate. And Jennifer may be able to tell us more about that. If it's a send out to the state, then it's a PCR.
So there's no consistency in Montana. It varies depending on what tests they use.
Correct.
And just one other question. Is it true that on December 31st, the PCR test that they had was discontinued and they were supposed to get different ones?
The one through the hospital?
Well, it just was a standard from the Department of Health.
It depends on the test. So again, they're not all the same.
Okay. All right. All right. Thank you for now.
Okay, well, thank you.
I have a comment.
Go ahead, Glenn.
Elena, I know Marie from the hospital said she visited with you on your concern for the cycling and that they were the higher cycle. So that was something that Maria told me, that she had visited with you, that your concern was it had to be higher than 35, and it was.
Okay, because Maria sent, I'm sorry, Maria sent me the link to the Canadian Public Health Board. And so maybe I missed it, but it is higher. So then the test can be false positives and false negatives. And that's why they don't know if it's COVID, the SARS, or Delta, or the new one, or anything. So no consistency. Thank you. Point made. Thank you.
Because she needs to go see some patients. So, did you have anything else, doctor?
The only other thing that I had on my mind that's come up in Anaconda recently has to do with the testing that's being done through public health, and just hoping that we can have some consistency. And Jennifer, this may have already come up on the Anaconda side. We're sending a consistent message that it's really important that they communicate with their physician with regard to that positive test, as opposed to just isolate and kind of the current quarantine guidelines, just because the options for treatment have changed so much in the last 6 months that we now have really good treatments that are really effective, particularly in our county where our vaccination rates are ridiculously low. But those patients are most of them are going to be candidates for some of the treatments that are really only beneficial early in the disease. And if they don't show up to our office until they're really sick, that ship has sailed. But we have treatments that are available readily in our communities. So it's just really important that we're communicating that to patients, that they should call and talk to their doc so that they can get treatments that can be life-saving if we're giving them early.
So doctor, we do say that in Anaconda and in Granite County. So if we are getting tested through the public health, the first thing that comes out when we're talking to them is that, yes, you are positive, but you do need to get a hold of your primary physician to let them know what's going on and if there is a treatment that they can be, because there's the two, the monoclonal and the other treatment.
Yeah.
That they talk to their primary physicians. Yes, we do. That's one of our top things to the patients.
Okay.
Well, thank you and good job.
Are there other questions that people have before I step away?
Don't look like it. I don't. Do you guys in here? Anybody have a question for Dr. Khan? Nope. You're good. You can go do your job. Thank you very much.
Thank you.
You're welcome.
Okay, so we're gonna move on.
Elena has a comment.
Oops, I missed her.
Yeah.
Sorry. We're moving on. She's already shut off.
Okay.
All right, that's my bad. I gotta learn to, I'm not sure what the hell goes on. We're moving on. That's my bad, Elaine. I missed you. So we gotta keep moving on here.
That's just bio.
So we're going to the Granite County Tobacco Prevention Report from Amanda.
Yep, so I visit your community mostly on Thursdays. Once in a while I come in on a Friday. I've been delivering signs to your businesses and just giving them updated signage and visiting with them about the state code annotated and why they need a sign, and peeling off the old signs and putting up new ones because some of them are faded and that kind of thing. It's fun and engaging for me. I like that part. Also working with locating more multi-unit housing in your area, because I'd like to create a database of who's offering smoke-free housing. It's just meant to be helpful. So do they have a policy or a record for their tenants to sign? Are they being successful with their current policy? Do they need some language to make their policy a little bit stronger? And is there good compliance with their rules? And then we offer free signage and metal signage and how they can get that. And then do they want to offer any kind of quit materials for some of their tenants that might be smoking or smoking outside or that kind of thing? So that's going well so far. I've located 3 of them and working with the person who's in charge of those units. The ones I have found do have smoke-free housing, and she would like assistance on her language, so it was pretty cool. I am also signed up to be a speaker in Drummond at their library the 1st of February. And I will just give a recap on my position in the community, all the different things that I offer, and then just let them ask for, just to raise awareness that I can work with schools or do presentations and smoke-free housing and signage and all that kind of thing. And so I also attended your DUI task force meeting and proposed an event to partner on with youth at the high school. I met your youth ambassador that is a part of the DUI task force, and she's really great. She likes the idea of doing a survivor lock-in at the high school that's oriented for tobacco education, vaping, teen quit materials, and also the Phillipsburg school still isn't a tobacco-free school of excellence. So I think the event kind of educating on what that means, I think all the pieces that you need to be a school of excellence is there, but you just need to like tie it all up together, check their handbook and see if it talks about vaping and where staff smoke and things like that. Raising that education and awareness, and maybe after the event, the school would like to make the move with the state and OPI to become a tobacco-free school of excellence. So that's my report.
Good job. Thank you very much. Is there any public comment for Amanda, just on the smoke-free stuff? Thank you very much. That's a good report. And good luck on what you're doing. Okay, so we'll go ahead to the Granite County Public Health Report from Deb and Jackie.
I'm Deb and Jackie.
Okay.
I don't know if Jackie's on the phone. If she's
I
on
think
the phone.
she.
Jackie is on.
Can you hear us, Jackie?
Good morning.
Okay.
Hi, Jackie. I'll go first and then you can add to it, okay?
Okay.
All right. So the public health update. So as you know, we provide public health services in Granite County, and that includes communicable disease and immunization program. We also have the maternal child health block grant, which includes the FICMR program, which is the Field Infant Child Maternal Mortality Review. We did not have any deaths to review for 2020, but we're going to have some for 2021. So we'll be doing that. We also have the Area 5 Agency on Aging program, which we have home companions for the elderly and disabled in need. And so I'll just go through the programs first and then give an update. WIC, we're also providing through our public health nursing and maternal child health WIC services, Parents as Teachers, which is a home visiting program, and the oral health program. And then of course I supervise the mental health coordinator, Jennifer Robinson and Amanda with the tobacco. So we have provided immunizations, COVID immunizations, and have done communicable disease investigations. We're recruiting in the Area 5 program. We're recruiting for an additional companion, but that has proven to be difficult. But we did get that position modified. So that should help. We have had families come to WIC in Drummond, so that's exciting. And we have some more families scheduled coming up. We've done outreach for Parents as Teachers, and we're working in the oral health with the WIC, where we can apply fluoride varnish to children's teeth up to 4 times a year to prevent cavities. So that's where we're at, and I'm available for questions. And Jackie, you have anything to add?
I just have to add that the literacy program is putting on a suicide prevention at the Granite High School on the 25th of January, and they asked if we could provide pre and post surveys for that event. So we will be sending those to the school for, and we'll help them with their grant, and also kind of give us an idea where we're sitting with, suicide education in Granite County. I think that's about all I have. Oh, Leanne, did you talk about the Red Cross that we're coordinating with them to put on some school programs?
No, I thought you could do that, Jackie.
Okay, so after our loss of a youngster in Granite County in January, Public Health and Disaster Emergency Services are working with Red Cross, and we're offering some classes in the school into Drummond and Phillipsburg. We haven't heard back from Hall yet, And we're gonna go do some classes on fire prevention and what to do with the youngsters. So I think that's a good program to offer our county.
This is all on the website too.
It is not, because we're just in the planning stages of it. We don't have anything.
Okay.
Yeah.
I just think that'll be coming up, so I thought I'd ask quick.
Yep, absolutely. We just don't have dates scheduled yet. The teachers are working with Shelley Krevlin with Red Cross.
Okay.
And that's all I have.
Okay, this second, Amanda has a comment.
I was just gonna say, we are actually recruiting a quarter-time tobacco person too, and if they were devoted to Granite County, that would be great, but it's not necessary. If they wanna cover Granite, it'd be awesome if they lived in Granite.
Okay. Thank you, Jackie.
You bet. Thank you, guys.
Got one more comment.
Oh, because I do supervise these other folks, I did have a couple, well, just one comment. And that was with regards to the Jefferson County question. So when you have a document and it shows who the originator was at the bottom of like a Word document, it shows where that document originally was created. So we were all part of a McFEP group, is what it was called. So a group of counties work together to develop programs and documents, so that all the documents are essentially the same from county to county, other than individualized, accordingly. So templates are developed by other counties and shared, and we have a sharing resource. We had a real FEP guru in Jefferson County at one time. I know that did a lot of the documents. That should clarify that.
Okay.
We have a comment from Mary Weaver.
From who?
Gail.
Oh, go ahead, Gail.
Hi, thanks, commissioners. I just want to tell you that I think these reports are so thorough, and that I'm able to write notes, and then I have a council meeting tonight to be able to share and get in our minutes. I just think that everybody is doing a really good job, and I see such an increase in Granite County's more programs coming to Granite County. So thank you.
Thank you for your comment.
And if we could get this darn COVID to go away, just think of the things we could do. Right? Okay, thank you all for your support.
Okay, so we'll go ahead and move on. It's appointment of new health and board members. Discussion and decision. Do we have any?
We don't. I have some people that I want to keep talking to try to get to apply, but I haven't
Good job.
gotten any.
Yeah. All righty. Well, I guess we'll move on to the next one, the discussion decisions of matters related to an infection and disease control. Who's this one with?
For you guys to discuss regular health board stuff. If you guys have anything, policies, anything.
I guess I'll jump right in on, I think this is just a recommendation. I think that each county employee should be given this, what the isolation, what to do if you test positive for COVID-19. I don't think they really understand how serious this is and where it's going. And I just think that each one of the county employees should get this and maybe even sign it so they actually read it and know what it means. It's up to the health board, I guess, but what do you think, Blanche and Chuck? I guess you guys are.
Is this the document that Jackie and I forward on to? Okay, perfect. Thank you.
Is it on the website?
Yes.
But I just think each county employee should get it and they should sign it and return it. I don't know if that's too much asking,
No.
but
No.
I was gonna read it, but I don't think there's no sense of reading it. They can read it.
They can read it, yeah.
I do have a comment if I could. And that is that they actually have, unfortunately, we're preparing for everybody to at some time be test positive for COVID. Just because of it's this variant right now, the Omicron. accounts for 80+% of our cases statewide, and it's very, very contagious. It's 3 times more contagious than previous ones. And people who are vaccinated are getting fewer symptoms. So I just have to say that.
I agree. I just,
So, but I agree with that. I would support that. I think especially the chances of working in a place like this with other people, there's a real high chance that everybody's going to be infected at some point.
good, because I was gonna ask for the support from everybody on this, and it's just, yeah, there was something else to say. Go ahead, Amanda.
I think it's a good idea. Some people are just not aware of what the procedures are, and if it's just a document that they're reading, then when a member of the public engages with them, they should have a little bit of knowledge after reading that paper.
I agree, and then it's just that, you know, and I really thank everybody for what they're doing and that, and it's a kind of a crappy job when you have to call people and that, and it just, I mean, I really appreciate what everybody's doing, and just need to support each other and just keep moving on. It's not going away. It's keep hitting and missing, but we have to support the people that are telling us what to do.
I'll make a motion that we recommend the updated CDC report updated at 12/27/2021 be passed out and signed by all county employees.
A second.
Any public comment?
No, I'll second it.
Okay, thanks, Chuck. Chuck, Commissioner Hinkle seconded. Thanks, Chuck. Any public comment?
Elena.
Go ahead, Elena.
Did you say the report from CDC from December? Was that the latest
Yes.
one? That was the latest one?
The one that we have.
She just read it.
Because I think there's a later one, if you go to their websites, CDC, I believe there's a later one.
Okay. Thanks for your comment.
I recommend that the updated version be signed by all employees, county employees.
Okay, so we'll move all in favor?
Aye.
Aye.
All right.
Thank you, you guys. I really appreciate that. I just think it's a big deal to do. Just so, is there any other comments on health discussion with the related infection disease control? Does anybody have any? Kayla? Anybody? Okay, so public comment. Got 5 minutes.
Elena.
Go ahead, Elena.
Okay, I was just wondering, since we on Zoom can't see everybody who's present there, does everybody have masks on?
Pardon me?
Does everybody have
No.
masks on?
No.
Okay, just wondering. The other thing I wanted to ask, oh, thank you, Blanche, for coming in and about that Jefferson County thing before. I did send Billy something this morning. I would have sent it to everybody, but I did send a carbon copy to Blanche since she is my commissioner. And I wanted Billy to share it with everybody on this public health board. And so some answers and stuff. The reason why I couldn't share it with everybody is because, again, on the website, there is no email addresses for the board members. And they can have a county email address. The same thing with all the boards. There's no contact information if the public wants to send them something. So that's basically my public comment.
Okay,
Thank you.
Anybody else on public comment? We have that here and they're looking at it, Elena, so it's passing around. So being there's no other public comment, we can adjourn. Is there the next? You know when the next one is?
They're quarterly, so it is in the spring.
So while Billy's looking that up, there was 4 other documents that needed to be signed by the board members, and I only have 2 out of the 6. There's somewhere, I set them all on Scott's chair, and I don't know, that's them. I'm gonna sneak over here real quick, Scott. There's 1, 2, 3, these are the other 4 for everybody to sign, please.
Do we need to make a motion on this stuff, or we already
Yes,
did?
you already made a motion, it just needs to get passed around for everybody to sign.
So the next Board of Health meeting is in April. March, April, either April 12th or April 19th. You guys decide.
12, I think would be better.
Okay.
For me, I mean.
So April 12th at 9 a.m.
This one's already been signed.
Perfect.
This one's been signed.
Yeah, there's 3, the commissioners already.
Yes,
Chad.
yes, no, here you go.
There. And then there.
Okay, so it'll be April 12th is the next meeting. I just want to thank everybody for all the stuff they do and good job. Any other comments? We'll move on. Right on time. Thank you, everybody.
Thank you. Thank you.
We'll move on to the road and bridge superintendent, Paul Hall. He had an emergency, couldn't be here. So, you guys got anything for road and bridge?
I think they're working tirelessly trying to get the roads. I mean, when I came through a few days ago, they were just clearing out the main street and they were doing a beautiful job.
Yeah, that's the state.
Oh, it's the state does the
Yeah,
main
that's
street
state
there?
to
The
city.
state goes from,
Main Street?
and down on Broadway.
Okay, but I've also noticed that like this street here, Sampson Street, I'm so glad that they cleared that out, because 2 weeks ago, Deb and I parked out front of the courthouse. And we put it in park, we put the brake on, and the truck just slid half a block down. I'm like, but I'm glad that they cleared it all up, because now we park there.
Did you have the wheels turned correctly?
We did, and it kept on, yeah.
Is, Chuck, do you have anything on road and bridge?
No, it looks good out here.
Paul said you could try call him a little later this afternoon. So
Okay.
come up, so, I don't have nothing. I did go look at that stuff yesterday with that, surveyor, Bear Gulch on that case we're in, so.
Yeah.
It went good. There's a lot of the stuff's gone, a lot of the ribbons are all just gone now, so I don't know. He got a better outlook, so that'll be good. So,
Okay,
other than
okay.
that, I don't have much. I guess being nothing, no public comment or nothing, we'll go off until 10 o'clock. Okay, all righty, we're on for the Georgetown Lake outflows review and decision, and is Brandon on?
Is that his phone number on the bottom? Popped up?
Okay, good.
Is it? Do you know?
I think, yeah, I think that's his number. I have it on here. All right, so it's at 6427.91, 19.08. Last week was 19.44. Any public comment on this?
Did you say 19.08?
Yeah, 19.08, Chuck. Last week was 19.44.
Well, we didn't gain much, did we?
0.4.
No, not really. It's got hope for more moisture. Yeah. You on, Brandon?
Hello, again. Was physical distancing, was there a whole bunch of people in here? Not that I'm worried about COVID.
So do we have you leave it as is, or what do you think?
Yeah, I'll make the motion and leave it as it is.
I'll
Okay.
second.
Any public comment? Being none, all in favor?
Aye.
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 Carried and passed, or leave it as what it is, and just keep an eye on it, close eye on it. That's all we can do right now.
It's going up?
It went down, what, 0.4?
Was 19.4, 19.
A little bit up. Okay, it's not a little bit down.
It's 19.4 now, it's 19.1.
19.08.
4 inches below full flow, and now it's 19.08 inches below.
Okay, so it's, yeah.
So it went down. Went up.
That's the
Inches
link
below.
below the lip there.
So we want to keep going down. So the number has to get lower for the water to come up, right?
Okay, we're back on. Brandon's called in the dam tender. We made a motion, Brandon, to leave as is, and it went from 19.44 to 19.08.
Okay.
Do you have any comments or anything?
No, the ice up there is starting to melt, but I don't know how much longer it's going to be as far as the readings and stuff, not being able to do it. Other than that, there's no changes that I noticed. Everything looks like it should, so.
Good.
Yep.
All righty. Well, thank you very much on your comments and appreciate the call in. That means a lot. Thank you.
All right.
Have a good
Yep,
day.
sounds good.
Thanks,
All right,
Brandon.
you guys as well. Thank you. Yep, thank you.
Bye.
We're going off till 10:15. Correspondence. Okay, we're back on for correspondence. Got a couple letters here. Okay, we have one from Mako. It's on a renewal of a membership.
What, renewal of insurance or health insurance or
It's
what?
National Association, NACO has been renewed.
Oh, NACO.
Yeah,
NACO.
NACO. Yeah. And then we have a letter from FERC. The letter acknowledges your 14/20/21 letter requesting an extension on the ODSP. Your letter explains you will. It's an extension on the ODSP. That's it for correspondence.
So the two requirements under the old 12B, then we got extensions on? Or is it
So because the ODS, oh yeah, we did.
the seismic?
The seismic, we got
They're
another
both
year.
till the end of a year extension.
The ODSP is until April, I believe,
Okay.
2022, and Roscoe, Reed, I believe is his name, right, with Dow. He said, he'll have it in by April, so.
Okay.
Oh, it's good. Jeremiah's gonna be on the agenda next week to go through the FERC requirements with you guys from the Part 12D inspection. the inspection plan.
Well, I guess the seismic is the end of this year, so.
End of this year,
so they'll have to
2022.
Go out for request for proposal.
Yeah. Hopefully it comes in astronomical.
Yeah.
68,000.
They'll have to be built up, so there'll probably be more requirements coming down. You back on.
I didn't know if anybody had anything with correspondence. Being nobody has enough for correspondence, and we went through the two letters, we'll go ahead and go off till 10:25 for the minute.
Oh, Elena.
Go ahead, Elena.
Thank you. Looking at the correspondence. I don't know, do the commissioners get this? Do they know that it's uploaded online? Because it goes up pretty late during the meeting, I think.
I put it up this morning right before the meeting started.
Thank you.
Oh, yeah, well, because that's maybe why they didn't read it. But on that letter from FERC, it's dated January 4th, 2020. And it's to Chuck Hinkle as the chair. And if anything, I know he probably signed the letter to them, but if anything, I was wondering if federal FERC should be notified that the chair is no longer Chuck Hinkle. And that brings me to my next point. On the website, the information is not there. Who the chair is, who the vice chair is, any contact information, especially their email addresses. They should have their own personal, not personal, but their county email address. That's just,
We'll make sure and update that.
thank you.
Okay, we're going on. For the board minutes for January 11th.
I make a motion that we accept the board minutes for, where is it?
January 11th.
January 11th.
You second it, Chuck?
Oh, here I have to unmute.
Yeah, I've been muted for quite a while now. Yeah, I second it.
Well, I guess.
Okay, any public comment? Being done, all in favor?
Aye.
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 Motion carried and passed for the minutes.
Shame on you, Billy, for muting him.
Yeah, we muted you, Chuck.
Sorry.
Sorry about that.
How's it going, Chuck?
Pretty good.
Good.
The next one's on negotiations with Point Creek. We'll just leave you on.
Yeah, I
Okay.
emailed Judge McLean to let him know that it would be early today because we have the opening of submittals. But I never heard back anything from him. We might call him if we don't. Yeah.
We're supposed to be getting something in writing from him, and I haven't seen the Flickr Hydro. But he is working, and he's trying to get it in there.
Ongoing, I guess.
Keyword.
Yeah.
Is it? Cool.
Do you have any comment on that, Chuck?
No, I didn't hear all of it. What did Billy say?
That I had called Judge McLean, or I had emailed Judge McLean to let him know that the mediations would be earlier today since you guys have the opening of submittals for the request for qualifications at 11.
Okay, that's right. No, no comment.
And Chuck, we're supposed to be getting something in writing, the offer, a formal offer from them, but we haven't received it. Flickr Hydro.
Okay.
So we have sent them all their, what they requested.
The financials.
Yes.
Yep.
To Judge McLean and the Flickr Hydro.
And it's financials, previous financials, which,
Yeah, I mean, they're trying to say over the long haul, the county spent things that they shouldn't have. But I don't see that in any of it.
I don't see that.
So being we never got, stuff on that, I heard there's, I don't think nobody's on it. Is there any public comment on it? No. So can we go to that? I don't know,
Talking about the 11-1.
yeah.
There was no submittals at all, so the county should just potentially look at reaching out. And Brandon Robinson was a referral I received if you want me to reach out.
Okay, well, yeah, do we need to make a motion on that? We told you to go ahead and just.
No, yeah, I won't make any decisions. I'll just reach out to him and get him on the agenda. Yeah.
Okay. Sounds good.
Who are you reaching out to?
Brandon Robinson is an architect
okay.
in Missoula that was referred by Paul O'Leary, and just see if you want to get on your agenda to talk to you. He's doing the new fire hall in Drummond.
Okay, well, I don't know, we're there on public comment. Are we still doing the site visit? We didn't have a key or anything.
I think Jackie does. Jackie's on.
I don't think she was coming up with it. I think she was talking about the Drummond one.
Oh,
You're gonna do both though, right?
yeah. I don't know.
Either one.
I think there's a keypad on it, isn't there?
I mean, I don't know what we're gonna, I guess I'm not sure what we're looking for, or what we're doing there. I know what the other one is.
Yeah.
The other one just needs to be cleaned out, and then if there's papers in there, if we can actually use and put some storage in there, talk to the volunteers, and just if there's stuff out, then maybe it should be put in a
lock filing cabinet.
That's all.
They have it,
If you don't mind, I guess I can follow ahead and get ahold of Frank, and if there's the chairman's Frank Prince, and then we can see if there's stuff there, just so like when the sheriff's got DUIs and stuff that they can use, or whatever it's called.
The back office, or
yeah, and then they got a place they can stop and paperwork in there.
So if we're gonna do a site visit, I would think that we need all three of us to do the site visit, and
Well,
at
it'd be
this
nice to have
time.
the ambulance people there too.
Yeah,
so
and
that-
yeah,
you can table
notify.
that too.
Cause I
Commissioner
don't,
Adler could go meet with them ahead of time too.
cause I don't know what we're really looking at.
Well,
or
yeah.
I know on the other one, we just need to, cause like the ambulance don't have the snow tires on or nothing yet, but I don't know if they're, what's the plan with the volunteers? It's not that we exclude them, it's just, what is the plan?
Yeah. I see the Eagle on the road today.
And when the next thing is we're gonna make sure that everything's up with the state.
Were these ambulance sheds notified that we were gonna make a site visit?
No, not
Okay.
intentionally.
Yeah, I think we better table it due to the fact that I don't think they were noticed, and I'm not sure what we're really looking for besides the one down there was for storage and maybe storage, and maybe using the sheriff could use that back room. But if there's, if there's paperwork laying out, maybe it should be cleaned up and put in if they need to get in.
Lock file
Yeah.
cabinet.
That's all.
Well, would we have to, like, make a motion that this is a county building and that we should allow when it's available for like the sheriff's office and.
I think the sheriff's office has already been using it.
I think one of the biggest problems, but one of the things was the garbage that people are bringing in and not cleaning up. Not so much the ambulance, because they haven't, but the others, they gotta take care of themselves. It can't be a pig pen. There's, food and
Gotta
stuff.
look be professional.
Yeah, I mean, we gotta keep it clean and then, cause if we get somebody come in and clean it out, cause there hasn't been nobody in there in a long time. If it- Jackie actually said she would clean it. I should. But it could be cleaned and then the paperwork should be put away and we could actually use it.
Yeah.
Or they, you know.
Yeah, well, like filing, a new filing cabinet's not that much, or.
I'll get a hold of Frank, though. I'll talk to Frank first. Is that right, Frank?
So we're gonna table a site visit then?
Yeah, cause I'm not quite sure what we're looking or what we're doing besides just seeing what's in there, but we know, I guess it'd be nice to have what's there or what they might need or whatever. I don't know what we're looking for.
Right, I just think we have to start talking about it. I mean, and figure out what we're gonna do.
Yeah, and then get hold of him and we'll have Billy send him a letter and try to email him and see if we can get him on for next week or the week after. Just give him a little heads up and he can meet us down there. We can go through it. And if you don't care, I'll talk to the chairman, Frank Prince in Drummond, and then see what his thoughts are and what's going there.
Yeah, that's fine with me.
Chuck, what do you mean that we gotta look into it? What do you mean by?
Well, you know, the building just sitting there and everything just sitting there doing nothing, and it's just gonna deteriorate. And I don't know, I mean, it's kind of hard to make a decision if we aren't totally sure the Eagle's gonna stay there forever, but you know what I mean? But, you know, I mean, just for that building and that equipment, just to sit there, it's not gonna do it any good.
So in that kind of situation, I guess we'd have to visit with the presidents of both associations and look at their income to see if their revenue has brought any extra revenue in.
I do know that a few weeks ago, Phillipsburg Ambulance did a run.
Oh.
That's right here, but not sure how, I think it's just one. They had to have come in and they're meeting him down there next week.
Yeah.
I guess we'll try to meet him down there next week, and if you could get a hold of Pat this week so we know that we're on, then we can come Thursday, we can put it on the agenda.
You
Got all right, Chuck? Lance?
Yeah.
Do what now?
Take and try to get a hold of Patrick, and then that way we can know for sure if he can meet us next week, and then we can put it on the agenda Thursday.
Yeah, either that or we could talk about it, just wait and talk about it again. I mean, yeah, whatever.
So right now, I think it would be if you were thinking of dissolving, you can't. Now it's you'd have to have it into the Department of Revenue by the end of December.
Well, I don't want to dissolve.
So no, I mean, but this is, we need to do some research on whether or not
what they're gonna do.
anybody's committed and if the taxpayer is paying for something that they're not receiving. I mean, that's gonna have to do some kind of.
Eagle might commit to a contract to agree to be here in the county so long.
And this we have to get with the associations and say, what are you going to do? Right now, they're very disgruntled and they're upset with the private ambulance coming in, but.
I don't know if Phillipsburg is so much, but it's just not real active.
Well, it wasn't active before. I mean.
But doing one run at least shows you that they have the capability.
The thing about it is, it's not that we're trying to get rid of volunteers. It's just, you know, people have lives and gotta do stuff, and where they're here 24 hours a day, it's about helping and saving people. It's not so much of, I just don't want the people to think that we're trying to get rid of them. That was not the plan.
No.
We never, ever said that.
No.
I know there's frustration with the way we did it, but we had meetings and I don't know.
Yeah, multiple meetings.
I just don't want them thinking that we just threw them under the bus, and we did not do that.
Okay, I'd like to make a comment on that. I think that the commission worked very hard in trying to be associated with both associations and trying to get the runs and trying to get training and giving them money. And it was almost, it wasn't working. And then when the private ambulance came in and offered their services, and we said, come into the county, you're welcome. We welcome your private service. We weren't saying that we want to get rid of the ambulances. No, we were saying that this county needs service and they were willing to come in. And so now we're looking at the situation where
Yeah, they're both being called out.
Yeah, yeah.
So they were.
yeah, and I think fairly called out fairly from what I understand, the sheriff's office.
I think at first there was a couple little flaws, but that's just getting started. And I mean, I think that both of them the new ones started understanding how it was. And I just like back to it again. The money is about saving and taking care of people. It's not.
One
I think
thing.
that to this point, you don't need a contract, but if you're wanting to just look at dissolving down the road, not that you are looking at it, dissolving the Volunteer Ambulance Association, then getting a contract with Eagle established.
And that would be because of lack of volunteers, I would think,
As far
as dissolving it. I mean, I don't know.
Yeah, if they're not functioning.
The big, there's the revenue coming in from the runs really helps out the both associations.
You have a comment, Chuck?
Yeah, I'd be willing just to table this until like this spring. We could think about it more. You know, not put it on for next week, just.
I guess, I think some of it was just to see if we can, shed down there in Drummond, if we could use some of the back for storage, and then the sheriff was curious about using that room. So I guess that's why it kind of got brought up, but it needs to be cleaned out, because, yeah, it just needs to be swamped out in a while. I mean,
Well, if you want to put it on for next week, I mean, yeah, that's fine.
Well,
Do whatever.
I'm thinking, like, Chuck, you're right saying that this really hasn't anything to do with the volunteers. This is trying to get use of the building for other,
if we can.
yeah, if we can.
The only thing I'd say is just try to get an update from both of them to see
Yeah.
what their plans are.
But I mean, like down there, it just needs to be nice to have somebody go and clean, bring the animals, drag them out. And I'll talk to Frank about it to see how they feel. And, you know, just to kind of have somebody look over the stuff and clean it out. And
That could be a agenda item, just you reporting back on what you find out.
okay, I'll just report back next week. Other than that, is there any other comments or public comments or anything?
Elena.
Go ahead, Elena.
Okay, this is the public comment period.
Yeah, go ahead.
Public comment period, according to the agenda, is at 11:15.
I know.
The whole point, the whole point of an agenda with items on the agenda is for the public. Okay? And when the public pulls it up and sees, okay, 11:15 is public comment, I've got time, and they go about their business. Then they come on at 11:15, and I think it was last week, you adjourned before. And are you going to do the same thing this week? You're going to adjourn at 12:30? Because that's what it says on the agenda. All right. And you know, and I just want to say this bothers me because it is for the public. And if somebody wanted to be there in person and they come walking in at 11 o'clock and they see nobody's here. I mean, this is my comment. The whole point of you guys doing this is for the public. And you can't make a decision during the meeting that you're going to close this and you're going to do this and you're going to do that and change the time. And I've also mentioned the fact that you're muting the participants. When you mute the mics, anybody that happens to be on Zoom, including Chairman Hinkle, gets muted. And if you forget to open up somebody, this is what happens. This is not the way a Zoom meeting should be conducted. And it has been conducted since March of 2020. So I think everybody should know how to conduct a Zoom meeting. Maybe you need some training. I think you do. And the other thing that I want to bring out is the documents that you uploaded. Now, I don't know the terminology, but PDF, the one that said Jefferson County, do you know I can go in there and change things on it? And nobody would know me changing things because it's in almost a draft kind of form. So I could, if I was malicious, I can change anything on it and nobody would know it. Okay, those are my comments. So I wish you guys look into it because I do have, I have that Jefferson County thing because I was going to bring this to your attention. I can highlight things, change things. I never realized that. And also on the agenda, I can do the same thing on that, the county agenda. So I don't know, maybe you should look into this and do something different. That's all I have to say. Thank you.
Okay, so what? I would think that, Elena, you're changing it on your site, but that doesn't necessarily mean you're changing it and it's uploaded to the website. Is that correct, Billy?
No.
So if she's going in there, I don't know why she can go in there and change it. And then if you chose to, is there even a choice to update it and bring it into new?
No.
So that, yeah. So I don't know if you can do that. As far as Commissioner Hinkle is not the chairman. He was made chairman, Scott was made chairman on the 4th of January. And that comes to the letter that you said that was addressed to Mr. Hinkle. Well, from the Federal Energy Regulatory Commission was, it was dated the 22nd, the day that Scott was made chairman. So, I mean, they wouldn't.
For 2022.
Yeah, and it's the 1/4/2022, and then if I heard you correctly, you said 2020. So I'm right. You're correct in the agenda and the agenda time, and we do need to address that a little better going forward.
She has another comment. Elena has another comment.
Okay, Elena, go ahead.
Thank you, Blanche, for bringing my comments earlier up, but that should have been addressed earlier. And anything I'm bringing up now, if you want to address it, then you can bring it up. I know that Scott Adler is the chairman now. The point I was trying to make at that time was that information that FERC should have been contacted about it being updated. And again, going back to the website, that information should be on the website. Contact information for all board members, not just Granite County commissioners, but every single department. It should be there so the public can say, oh, here's the email, I'll go in there and I'll do it. Or here's a telephone number. I can call them. I know that the commissioners are getting people contacting them on their private emails. I used to do that with you, Blanche. I had your private email until you said, Elena, I do have a county email, and you gave it to me. And now I send stuff to you on that email. Why aren't the other commissioners doing that? Why aren't the other board members in the different departments doing that? This is a government website, and it should have a government email for everything. And so, okay, I'm glad. So I'm going to see a change, right? The website still needs a lot of work. You're paying for it, and it's our money that you're using to pay for this website. Ours means me, the taxpayer. Okay? All right? Thank you.
Thank you for your comments. We're trying. It's not perfect, but we're getting there. Thank you. Have a good day.
So with her comment on the time frame, we really should address the budget.
Oh, yeah. I shouldn't have jumped
Yeah.
ahead. I was-
But
Yeah.
going forward,
We'll make it better. We'll make sure we stay on the agenda from now on. That's my bad.
Judge McLean never called in at 10:30. Should we call him?
Yes.
I think he's still waiting for that.
You gotta go along with it.
and just one point, Elena, when you made your comment about Chairman Hinkle being muted, you said Chairman Hinkle. That wasn't concerning the letter from FERC. That's why I addressed you in saying that Scott was the chairman now.
Thank you. We'll get better. I kind of got jumped ahead, and that's my bad.
Yeah, it's just
save my faults. All of us have faults.
going forward, we will address this accordingly.
It's the first time I've ever done this.
Yeah,
stuff
no,
here,
it
and I
makes
don't-
it different, and
You know, and
we're work in progress as far as I'm concerned.
I think there could be some flexibility in the,
Yep.
you can table items and move things up, but I understand that's a good point on, if
Oh, yeah.
people got on there later to give
Yeah.
the comments.
Yeah.
Yeah, I totally agree. I shouldn't have. Yeah, I guess like I said, I got too big a hurry, and I'm learning this here. I'm figuring it out. I still don't know how you know when somebody wants on.
There's a little hand.
So I'll let people on, and then when somebody has a comment, they'll raise their hand.
They'll raise
You'll
their
see
hand.
little hand pop up.
So you look for a hand.
Do you have it
Elena,
on
would you
that
raise your
mode where you
hand?
Can see everyone?
Yep.
Yeah, okay. So yeah, it should be a little yellow hand
Yeah.
that pops up, right?
Elena,
Bottom.
can you raise your hand for Scott? Okay, you see it? GBFM.
Yeah, I don't have no hands. That's what I'm
I don't, you really don't.
not seeing. All I see is that lights up. That's when I was like,
And that's
You see mine?
talking, you're fine.
See my hand,
Weird. Why not?
Scott?
oh, okay. Yeah.
Thank you, Elena.
Do you see it?
No, it doesn't come up on the Chromebook.
Yeah, so I didn't know.
Is it yellow border?
Yeah, it should be a little yellow hand, and he doesn't have a little yellow hand.
It doesn't do anything.
But sometimes this will come over here and light up that whole square.
That's whoever's talking.
Oh, so that's not.
That's why people need muted, because as soon as if they're not muted, there's background noise, and all of a sudden they're the ones that are
Yeah.
the main picture.
Yeah, I didn't, I mean, it takes time. We're learning. It's not,
And his is the same, oh, he's a
Okay,
Chromebook,
okay.
isn't he? I'm a not. Well,
I'll take your.
she will fix it for you.
I mean, it's help, I look at it all the time and say, hey, is there oh, I see that hand up there now.
Yeah.
Yeah,
So
you see my hand?
That's how it should show up. I wonder if we. Now you can see them on the side, see? No, it shows up blue on yours.
I think maybe
That TV FM just always Elena. How come that changes then? Just she wants it changed? Is that something else?
She can go into settings and change her name.
Why I didn't know if it'd stay at one thing, then I'd know exactly.
I think she was planning to keep it that way.
I think she wants to maybe make a comment.
Oops, I didn't see it, didn't come up. Oh, I see a blue hand. Does that mean her?
Yeah.
Okay, go ahead, Elena. I'm listening.
Okay, here I am back on. You have different views. Now, I don't know what your problem is there. One of these days I'll show up in person. You have different views. Now, if you go to the participants, you'll see the screen with everybody on it. You'll also see on the right-hand side, 7 participants. They're all there.
I see that now, thank you.
Okay, so there you have it. And if you are on, I guess you're on your iPad or whatever, then if you show Chromebook, if you had your picture up, you would be able to see it. Just like if I put a picture up, you would be able to see me.
I like looking at myself on it.
And I'll say it again, you are all elected officials. I am not an elected official. I don't have to put my picture up. But since you are elected officials, your pictures should be up. Okay? That's for the record.
Know who we're talking to, because I didn't know who TVFM was. Thank you.
I mentioned it earlier when I said this is Elena Gagliano for the, another thing, Scott, you've been the commissioner. This is your second term that you're finishing. This you have been doing, and you have been the chair when we were doing Zoom. So you should know exactly how to do with it. So don't tell me this is your first time. Thank you.
Thank you. It is my first time.
Yeah,
I'm not gonna argue with you. You don't need to talk to me like that. Thank you. Have a good day. I'm not gonna get into arguing with her over that. I've never done this stuff.
Well, this is your first time as chair of Zoom, because it was Bill and then Chuck and now you.
He actually Bill did 2 years of chair.
Yeah. So
And then-
2020 did
yeah.
Zoom, and then 2021 Chuck did Zoom, and now.
And then how many years did Bart do as chair?
1 or 2.
He did, I know for sure 2 right in a row, and that could have been 3. So I know that you have not been chair.
Well, you've been chair, but not with Zoom.
But not with Zoom.
Yeah.
I mean, I'm learning. I just, all of a sudden now I don't understand a bunch of this.
That's okay.
I don't understand why people can't have their pictures up too. I mean, they're saying that we, but it's all about it. It's fine. It'll be okay.
I don't know when the hands don't show up on your.
Just another happy pill in the day, another piece of candy. I'll be fine.
Another one of those Costco candies.
I mean, I have no sense of getting angry about it. I don't understand. I mean, and I apologize for the way it turned out.
All right. I think I go meet with someone. Unless you need me anymore.
We don't
But I'll
think so.
reach out to Brandon Robinson.
And, okay.
Yeah. All right.
All right. Thank you.
Have a good day.
So like at 11 o'clock, we'll just, today
Say that again.
Today at 11 o'clock, we'll wait till 11 o'clock and then we'll adjourn at 11 o'clock. And from now on, we'll just run the agenda the way it's going. Unless there's a table thing or something to move ahead on.
We still on?
You wanna go off? What is she saying that we can't mute? I didn't understand there when she was saying that. We'll go off till 11, in case somebody comes on, we can tell, that way I can tell somebody's hand comes on. Okay, we're back on for the 11 o'clock opening of submittals regarding Granite County request for qualifications. We didn't have any, but we're gonna reach out to a gentleman. Blaine's gonna, our county attorney Blaine's gonna do that. And we'll go on that. The public comment, we did that. It was my bad. I jumped ahead and, we'll run the agenda like we've been asked to stay on time in case somebody wants in. But this is my bad today. I jumped ahead. So on that note, we'll go ahead and adjourn for today, and next week will be better. Thank you very much, everybody. Have a good day.